Everyone, Shanika Esparaz here, and I am a board-certified ophthalmologist, medical retina specialist, and I very commonly see patients after cataract surgery with inflammation. Here's what to look out for. So number one, when you're seeing a patient with post-operative inflammation, for example, after cataract surgery, you want to ask yourself, was there any complications with surgery? Was it a super dense cataract? Was a Malyugian ring used? Does the patient have a long axial length? That could mean there was a lot of shifts during surgery, especially of the iris. On exam, you want to look at how much cell and flare there is. Are the cells pigmented? That's usually inflammation related to the iris. Or are there actual white blood cells, so non-pigmented cells, and that's usually inflammation just from the cataract procedure itself. You want to look to see if there's any vitreous strands or a peaked iris. You also want to gonio. This is key because several times I've seen fragments on gonio, and those can hide in the angle, and their course of treatment might be different for a patient who didn't have a fragment left over from cataract surgery. So those are things you want to look out for and the things you want to ask on history. Usually with treatment, I start patients on a combination of a steroid drop like prednisolone and a non-steroidal agent like diclofenac or ketorolac 4 times a day, and I see them back in a month. You could consider getting a uveitis workup if the patient has an unusual course after starting steroids and non-steroidals, or if they have rebound flare-ups after you taper them off the drops. You also could consider getting a fluorescein angiogram in patients who have CME or cystoid macular edema associated with their post-op inflammation, the FA, if there's leakage through the optic nerve or from the optic nerve. Usually that signifies that, yes, the cystoid macular edema is from Irvine Gass Syndrome, which is post-operative inflammation. If there's no leakage from the optic nerve and the patient has diabetes, this actually could be diabetic macular edema. I hope these pearls and tips help you when you are managing post-op inflammation.